Hi, Dr. Adam Goldman of the Metropolitan Vein and Aesthetic Center. Today I wanted to talk to you about endovascular procedures, and I wanted to give you some information about how to prepare, what to expect, and the aftercare, so you are informed and ready if that's what's going to be done. So let's go ahead and get started. So the preparation is fairly simple. Basically, you want to just bathe normally, reduce the bacterial counts of your skin to prevent an infection. You want to take any of the medications that have been previously prescribed, including blood thinners. The endovascular procedure is with minimal bleeding, and there's really no risk. If you need the blood thinners for any other reason, because of a tendency to clot, it's very important you take them. And if you took either an aspirin or an Advil beforehand and there's a slight thinning of the blood, there's no problem, because what we are doing has minimal risk of bleeding, basically. So once we get started, the first thing that will happen is that we clean the leg with an antiseptic. Then we will use the ultrasound to scan to see exactly what the anatomy is, so we know where we're going to place all of the equipment to do the procedure. The first step after that is to numb the skin with a small amount of anesthetic. It's done with a very small needle, so you feel a little sting, but basically it's not very uncomfortable. Next, we introduce some more anesthesia with a larger needle that we can then access the vein with. Once again, you will not really feel pain. It's more of a pressure sensation, but not really painful. And then as we enter the vein, sometimes you can feel a little sting, because if you put too much anesthesia in, it will actually start to compress the vein and you can't access it. So there's sort of a balance. So you may find a little pinch, but then once we're inside the vein, you don't feel anything. And then after we've accessed the vein, we then pass a wire and a catheter inside a sheath that will hold it place to be able to pass the other equipment that we need. Once again, you do not feel anything, because inside the veins there are no nerve endings, and therefore, the skin has been numbed on top, so really it's not painful. You just feel pressure or pushing, and you'll carry on normal conversations during the procedure. It's not a big deal. Next, the endovascular catheter, either a laser or RF, is placed. In the case of Venasil, there's no catheter that needs to be placed, but we will use the sheath that we had previously placed to do the procedure. If it is a RF or a vein ablation with laser, the vein is then numbed with anesthesia, and that is done over the course of the entire vein. You may feel some pressure. Again, we always go from one area that's already numbed and we start to numb the other areas. So in general, it's very well tolerated and it's not uncomfortable. Once everything is numbed up, then we can go ahead and start. So the catheter is put in place, we check the position, and then we start closing the vein. So again, not painful, but you will feel some pressure. Sometimes with laser therapy, you can feel sort of a funny taste in the mouth, but this all passes very quickly, and the whole procedure will take another few minutes, and then everything comes out. In the case of Venasil, we actually place the glue in the vein, and that is same pullback. However, there is no anesthesia needed because there really is no discomfort at all. So at the end of the procedure, we go ahead and we wrap the leg in an ACE bandage. In the case of Venasil, just a Band-Aid is needed over the entry point. And then you wear the ACE bandage that day and that evening. The next morning you take it off, shower. In the case of RF or laser, you would then use a compression stocking. We actually wear the compression stocking for the next 3 days. You wear it during the day, you don't need to sleep with it. And you can resume all your normal activities except for sweaty exercise, bathing in bath or swimming. And then after that, after 3 days, you go ahead and do that as well. You may feel some mild discomfort. Most of the time, it can be treated very easily with some Tylenol or some Advil, Motrin, or Naproxen. If it is more uncomfortable, you can always take the two together for some synergy. So mix the Tylenol with an Advil or a Naproxen or aspirin and get more pain relief. In addition, after 3 days, if you still feel some discomfort, you should wear the stocking a little longer. Also, you may notice some swelling, and that can be treated with the compressions therapy, as well as you can elevate the legs at night when you're sleeping to help drain the leg. So what to expect? So after the procedure, you may have a little bit of persistent numbness. You may have some bruising. You also may touch the area where the vein is under the skin. It may feel a little hard, a little tender. And that hardness can actually persist for quite a long time. Sometimes it can take up to a year for that to disappear completely. But shouldn't be uncomfortable after a week or so, and it should feel totally normal in all other aspects. The symptoms that were happening before with your venous insufficiency, such as cramping, heaviness, will start to go away as well. Sometimes there is a lag. It may take 2 to 4 weeks until you feel complete relief. Again, if you have a problem with your veins, varicose veins, swelling, discomfort, please feel free to make an appointment to have a consultation. During the consultation, I'll have an ultrasound to define what's going on, and then we can offer a treatment plan. Most treatments are covered by insurance if you have symptoms, and we handle all the authorizations if they're necessary. So please come see us at the Metropolitan Vein and Aesthetic Center if you're experiencing symptoms or problems with your veins. Thank you.